Assessing pulse. Equipment needed: watch, sanitizer, alcohol swab, stethoscope, pen and note. Start the procedure. Greet the client, introduce self. Explain the procedure to the patient. Check patient name and ID band. Hand rubbing or hand washing. Provide privacy. Assessments. Determine the need to assess client's pulse. Assess factors that influence characters of pulse. Assess site most appropriate for pulse assessment: radial pulse or apical pulse. Review pulse baseline if available from client's record. Keep client in comfortable position, supine or sitting position. Locate the place of radial pulse. Keep the watch ready to count the pulse. Place the tips of first two or middle three fingers of dominant hand over groove along radial or thumb side of client's inner wrist. Place the client's forearm across lower chest, with wrists extended straight if supine. Compress fingers against radius. Looked at watch when pulse is palpable. Counted rate of 15 seconds and multiply by 4 if pulse is regular. Count for 1 full minute if irregular. Assess regularity and frequency of any dysrhythmia. Determine the strength of the pulse. Assisted client in returning to comfortable position. Discuss the findings with client and informed nurse in charge or physician. Document the findings. Assessing apical pulse. Clean earpieces and diaphragm of stethoscope with alcohol swab. Check if the stethoscope is working or not. Expose sternum and left side of the chest. Palpate Lewis angel, located just below suprasternal notch. Place index finger just to right client's left of the sternum, and palpate second intercostal space. Locate left mid-clavicle line of the client. Proceed downward until fifth intercostal space. Palpate point of maximal impulse PMI. Place diaphragm of the stethoscope in palm of the hand. For T to 10 seconds, place diaphragm over PMI and auscultate. For normal S1 and S to sounds lub-dub sound. Used watch and begin to count rate. When S1 and S2 were heard regularly, count for 30 seconds and multiply by 2 if heart rate is regular. Count for 1 full minute if heart rate is irregular. Note regularity of any dysrhythmia. Cover the client-assisted client. In returning to comfortable position, document the findings. Discuss with client and inform nurse in charge or physician. Clean the stethoscope, return equipment, discard waste. Hand rubbing or hand washing. Evaluation. 1. Established baseline if not available to. Compared client's pulse rate and characters with previous baseline. 3. Assess pulse again by having another nurse conduct measurement if pulse character is abnormal or irregular. 4. Identify unexpected outcomes. 5. Record findings in Al-Shifa system. How to document in vital sign flow chart. Go to reading. Then click on vital signs. Document the rate,